Exploring Ashwagandha, a natural solution for autism and ADHD in children. Welcome to DRS Research. Vidania somnifera, Ashwagandha, has been traditionally used in Ayurvedic medicine for over 3,000 years to treat various diseases and health conditions. It has demonstrated antioxidant, anti-inflammatory, anti-cancer, anti-stress, immunomodulatory, and several neurodegenerative effects. Vidania somnifera contains various bioactive compounds, called vithanolides, which are responsible for many of its therapeutic properties. Some of the most abundant and well-studied vithanolides include vithanolide A, vithanolide B, and vidafrin A. Studies have shown that Vidania somnifera and its constituents have strong antioxidant, anti-inflammatory, anti-cancer, antimicrobial, and neuroprotective activities. It has also demonstrated efficacy in treating stress, anxiety, cognitive dysfunction, and arthritis. Various clinical studies shows Vidania somnifera reduces stress and anxiety and improves cognitive function. It may help treat obsessive-compulsive disorder, schizophrenia, and bipolar disorder. Vidania somnifera has antioxidant and anti-inflammatory properties. It protects against neurotoxicity and aluminum-induced toxicity in animal studies. Vidania somnifera has anti-cancer, cytotoxic, and chemopreventive effects. It may inhibit tumor growth and cancer cell proliferation. Vidania somnifera demonstrates antimicrobial activity against various pathogenic bacteria like Staphylococcus aureus and Escherichia coli. Animal studies indicate Vidania somnifera has anti-diabetic effects by regulating blood glucose levels and shows potential to prevent cardiovascular diseases. Ashwagandha contains choline, an essential nutrient that plays a crucial role in brain development, neurotransmitter synthesis, and liver function. The herb is a rich source of potassium, an essential mineral that regulates blood pressure, muscle contractions, and nerve signals. Multiple human clinical trials provide evidence that Vidania somnifera reduces anxiety, depression, stress, and insomnia when administered for 4 to 12 weeks without significant adverse effects. Vidania somnifera shows adaptogenic, anti-stress, and anxiolytic activities in animal and human studies by modulating the hypothalamic pituitary adrenal axis and cytokine levels. Vidania somnifera shows neuroprotective effects by reducing oxidative stress, enhancing antioxidant defenses, and promoting axonal and dendritic repair in the brain. Animal studies indicate Vidania somnifera has anti-diabetic effects by regulating blood glucose levels and shows potential to prevent cardiovascular diseases. Vidania somnifera demonstrates anti-inflammatory and anti-arthritic effects by suppressing cytokines and inhibiting expression of cell adhesion molecules and signaling pathways involved in inflammation. Multiple human clinical trials provide evidence that Vidania somnifera reduces anxiety, depression, stress, and insomnia when administered for 4 to 12 weeks without significant adverse effects. Vidania somnifera shows analgesic effects for osteoarthritis and knee joint pain in randomized controlled clinical trials. In conclusion, Vidania somnifera is generally well tolerated up to doses of 6 grams per day in human studies of 2 to 3 months duration. Doses up to 100 milligrams per kilogram in animal studies for 28 days showed no toxicity. Caution should be exercised regarding the use of Vidania somnifera during pregnancy, as it may have abortifacient properties. Limited data suggest it is safe at doses up to 2000 milligrams per kilogram in animal pregnancy studies. Further clinical research with larger sample sizes are needed to validate the cognitive, antidepressant, anti-cancer, and other therapeutic effects of Vidania somnifera and its compounds. Studies on bioavailability and synergistic effects are also warranted. Stay healthy, stay safe. Thank you very much.